Open enrollment is almost here, which means it's the perfect time to make sure that you and your family are covered. It can feel overwhelming, but the good news is you don't have to figure it out alone. Joining us today from Omni Family Health are Yuriko and Pedro, and they're here to explain what open enrollment really means, why renewal matters, and how Omni is making the process easier for everyone. Hello.
Hi. Hello.
Great to have you on today.
Thank you.
Okay, so let's start simple for our friends at home. What is open enrollment, and why is this such an important time period in the year?
So open enrollment is a time when individuals who are uninsured or underinsured can obtain health coverage through the California's insurance marketplace, also known as Covered California, and they can compare and select the health plan that best meets their needs. It is important to enroll during this period because outside of this open enrollment period, you can only obtain health coverage if you have a qualifying life event, such as getting married, having a baby, or involuntary loss of health insurance.
Yeah, these are more rare, so you need to make sure you're looking at your coverage during this time of year to make sure it's the correct one for you. Let's talk about the key dates we need to keep in mind for this one.
So open enrollment runs from November 1st of this year to January 31st of next year.
So if somebody currently has coverage through the market, do they still have to renew, or is the plan going to roll over? Should we be looking at it?
Well, actually, it's very important to renew your plan, and because there's different types of benefits and providers and premiums that change every year. It's also important to know that 2025 is the last year that coverage will renew on its own.
Oh, okay.
Yeah, beginning 2026, plans will no longer renew on their own. So that's what's important, to review your plan and update those changes now.
I'm glad we met today because I was unaware of that myself as a marketplace purchaser. So that's not going to auto renew. I need to look at everything and manually renew it for this following year.
Definitely.
Okay, so I mean, if you're like me and you had no idea, it's kind of risky to assume that it's going to auto renew, right?
That is correct. It won't auto renew for 2026. For 2025, it does auto renew, but again, it's important to update your income, dependents, change of address to avoid having to pay back any premium tax credit. It's important to review all your health coverage and update all these changes to avoid any future surprises.
Well, yeah, a lot of times those plans will change, whether it's doctors being covered or networks or medications, and then if you just auto renew without looking at it, you could be out of luck a little later on.
That is correct.
So does Omni offer help with getting enrolled if we have any questions about all this?
Yes, so Omni has a team of certified enrollment counselors who are ready to assist with health coverage Monday through Friday, 8 a.m. to 5 p.m. at all of our health center locations. And this is at no cost to you, no commitment. You can simply come in, review your options before you are ready to select a health plan.
What do I need to bring with me? Because there's always so much documentation you have to bring.
Right. Well, you need proof of income, proof of identity, and ensure that all your documents are current. That is all we need.
And we need all of the identity and all that stuff for our kids or any dependents that are going to go on our plans too.
Well, we do need the information for all of the recipients that will be on the health coverage. Yeah.
So if we are listening right now and we're going, oh, that sounds like the best thing ever, I'm going to get some help, I can find all these documents, is there a really easy way for us to be able to book these appointments?
Yeah, so you can actually just text our 1-800 number, so it's 1-866-707-OMNI, or call us and select option 8 and schedule an appointment with one of our certified enrollment counselors.
I love the texting. That is probably, maybe it's the millennial me, but I was a latchkey kid who wasn't allowed to answer the phones.
It's very convenient, yes.
Now I get to just text and get appointments for not only this, but for all my health appointments. It's amazing.
Yes.
It is.
Well, thank you so much. And everybody at home, make sure you contact Omni. If this seems complicated at all, they can make it really easy for you. That's great.
Thank you for having us.
Thank you.
All right, we're going to keep chatting more Studio 17 right after this.